We will now proceed with the expert panel discussion, and I invite all the expert speakers to join both Misozi and Xavier on the stage. Please, Miss Isabelle Joyce, and also Isabelle Jost, and also Joyce Ouma. Okay. So first, I would like to invite Agatha Dafarel, who can't be with us today physically, and it's online right now, I believe. Agatha, can you hear us?
Yes, hello everyone.
Okay, it's a little bit morning here, so that's why the response is a little bit dull. So first, I would like to introduce Agatha Dafarel, who is on the screen right now, joining us here today virtually. She is the program manager of a youth-led organization called Inti Muda in Indonesia. At the same time, she is one of the members of the youth reference group, but unfortunately, she can't be here with us today physically because of the visa issues. Then I would like to introduce Isabelle Joyce, the program analyst to the youth team of the UNFPA East and Southern Africa Regional Office.
Good morning.
And lastly, we have Joyce Ouma, the influence and also engagement advisor at Y Plus Global today. So, Alice, maybe you would do us the honor of facilitating the panel discussion. Thank you.
My pleasure. All right, thanks, colleagues. Agatha, I would like to start off with you. We know that in your region there are some wonderful youth-led CSE, many of which is digital and really focused on young key populations. Could you tell us a little bit more about the impact of the work that you are doing and what results you have seen in Indonesia?
Thank you so much. Can you listen to me clearly?
We can hear you loud and clear, and we can also see your beautiful face.
Oh, thank you so much. You're not the first one to say I'm beautiful. For comprehensive sexual education in our region is basically very wonderful. We see the differences between when CSL was being spoken by the adults to young people and when it's equal, young people talking to young people. So the young key population feels more safe. They also feel that there are less judgment, even though we know that a lot of adults actually don't judge when it comes to comprehensive sexual education. But when they see that it's them who also present what is comprehensive sexual education, they somehow feel more safe and they feel motivated because they see that, oh, I can be that person. That person is just like me. We both are young key population. So much more than just talking about comprehensive sexual education, we also empower a lot of young key population to actually believe that they can be anything, because it is very possible for young key population to be more than just beneficiaries, but to also lead our own movement. And in Indonesia itself, it's still very hard to talk about comprehensive sexual education because of the religion barrier here. But so far, it's been wonderful. We have support from basically everywhere, even though it's not from the mass public, but we can see the small changes such as the involvement of the local government and local stakeholders in, so like forming this curriculum talking about sexual health, even though it's not very comprehensive, but we already see the small changes that we hope will be continuously good until we can finally see comprehensive sexual education being talked about and being taught in school and out of school for young people in Indonesia without stigma.
Wonderful.
I think that's it for me. Thank you very much.
Wonderful. So great examples there of young people leading the response and the effects of peers young people working with young people and providing that information and all the change that you are advocating for as well at a country level. Thank you so much, Agatha. So Xavier, Agatha mentioned that there's sometimes barriers to CSE, and we have been implementing CSE for decades now. I wonder if you could speak a little bit about, we continue to see strong opposition to CSE from some quarters, and I just wondered if you had some key messages that were important for the advocates and the decision makers in the room, also to help us in how we approach this opposition.
Thank you, yes. Thank you for that question. I think there are two types of opposition. There are some parents and authorities legitimately concerned about the effect of CSE, and it is very important to be able to respond to those concerns. And then there are some other attacks which are, shall we say, mainly based on fake news and at least untruth, and which often rely on a limited set of messages. So it is very important for us that we have in mind a common set of messages, all of us, to be able to respond to that. And that is HIV, EUP, and gender-based violence are a threat to health and education of adolescents and young people. Health education enables young people to lead full lives to protect themselves from those threats. And responding to those threats protect families, it helps completing education, and it helps reaching economic empowerment. So health education is very important for those reasons, and it can be effective only if health education programs are developed with all stakeholders: adolescents and young people, national authorities, traditional and religious leaders, and experts. And finally, effective programs are implemented with parents, and they strengthen parent-child relationships, communication, and dialogue. And if we all have these messages in mind, we will make a more enabling environment to respond to opposition.
Wow, thank you. I hope you are all quickly writing those down. And I love the framing of it to be broader than just sexuality education, that it's the health and well-being of young people. Thank you, Xavier. So Joyce, you're very far away. Hello. Hello. Oh, there's no mic. Okay, we'll have to share. Great. So Joyce, you recently led the update of some critical guidance that is to support adolescents living with HIV in young key populations in the education setting. Congratulations.
Thank you.
I wonder if you could expand a little bit more on the new content that's in the guidance, how this guidance can be used, and who the guidance is intended for.
Thank you so much, Alice. Good morning, everyone. Good morning. Hi. How are you? Well, I had to take my 15 seconds of fame. So yeah, as Alice mentioned, in 2021, on behalf of Y+ Global, which is the global network of young people living with HIV, I was privileged to lead a piece of work around revising the positive learning, meeting the needs of learners living with HIV in the education settings. And in a very unique model of partnership between the global network of people living with HIV and UNESCO Global Office, we came together to lead the revision process of the particular guide. So this initial guide was set up or was published first 10 years ago, and realizing that the needs of young people living with HIV in the education settings first were unmet, even in the past decade. There has been a lot of development, there's been a lot of conversation around diversity and around inclusion, and mostly the fact that young people are still facing the same challenges that they faced 10 years ago. Stigma and discrimination is still an issue. Young people are really being stigmatized, they're being bullied, they're being exposed to violence because of their HIV status or because of their sexual orientation. So we came together and we conducted 6 global consultations, from actually 6 regional consultations, but globally. And we got feedback from 120 young people living with HIV in all their diversity. And that their voices is what was translated into the positive guidelines, how the education sector can meet the needs of learners living with HIV. So to answer your question, Alice, who these guidelines are meant for, the guidelines are meant for everyone who is very intentional about meeting the needs of learners living with HIV in the education settings. You have seen what, the negative impact of stigma and discrimination, the negative impact of forceful sharing of one's HIV status, the negative impact of the side effects that the medication actually exposes young people living with HIV to. And so this guideline is a collation of the voices of young people actually telling all stakeholders what they want the stakeholders to do for them in order for them to have a conducive environment, in order for schools to be a conducive, well-relatable environment that can also promote effective learning and also improve the learning outcomes for young people living with HIV in all their diversity. And I remember one young person said that schools should be a safe space. I would love to feel safe because I spend most of my time in school. But as it is now, I don't feel it. And this was very scary for us when we conducted this these consultations, because we related as a network of young people living with HIV, and the fact that across board, across the globe and across the continents, the experiences did not differ. The intensity is what differed. And that simply implied that for so long, the young people have been going through this, but nothing has been done. But with the new positive learning guidelines on how the education sector can meet the needs of learners living with HIV, the needs of learners living with HIV have been packaged into 7 key areas, among them comprehensive sexuality education, sexual reproductive health and rights, treatment care and support, diversity, sexual reproductive health and rights, and just making schools into a well-conducive environment for everyone. And this particular guide can be used by everyone. Advocates can use it as an advocacy guide. Governments and key decision makers can actually use it as a tool to make decisions when programming for young learners in the education settings. And all of us can actually use it when we want to meet the needs of learners living with HIV and ensure that they have equal and actually equitable learning environment. And let me leave it at that. Thank you, Alice.
Amazing, Joyce. It sounds like a fantastic resource for all of us to be using. Okay, Misozi. So you presented some evidence today. We're still learning a little bit more about the effective implementation interventions when it comes to livelihood. But I wonder if you could speak a little bit more to the implementation of them to ensure that we get these multi-layered comprehensive programs and how that can lead to impact across many outcome domains for young people.
Okay, thanks, Alice. So I think one thing that all of the interventions had in common is that they're layering multiple different services in addition to the livelihoods. So for example, I spoke about the Cash Plus, which was spoken to yesterday as well. In addition to the cash assistance, what other services are being provided? So I think it starts with the design of the projects. And that's why I mentioned in the recommendation that it's also important to include the young people who are implementing these livelihoods programs for. What do you need to see? What activities will build you? What interventions do you require? So when we talk about the health sector, for example, I can speak to dreams. Once these young women are enrolled on the program, as they're receiving these livelihood interventions, they also have access to PrEP, they have access to educational support, their families are also being reached through a parenting program, and they're also linked to sexual gender-based violence. So what we're seeing here, and it's across all of the examples I've given and some of those that were given yesterday, is that the interventions have to be very comprehensive in order for them to work. So when I go and look for certain services, it should not just be limited to livelihoods, because other needs are also there. So I think he also spoke to the same in terms of education. So the reverse works. You're providing educational support, but what about your livelihoods? What about your SRH interventions, for example. And to make that succeed, it involves a lot of key players. You need all of your line ministries involved, you need different implementers, and you also need an effective referral system. Not all projects can provide all of the services that these young people require, so an effective referral system also supports. So where I cut short another either the government health facility, for example, or other projects would be able to meet those needs. So I think that's also very key, not just the design and the interventions that are packaged, but also a very effective referral system. Thanks.
Yeah, we've heard a lot about linkages and referrals the last couple of days. Maybe that should be a session for next year's workshop. That's fantastic, thank you. And I think, so moving on to what helps implementation a little bit is thinking more of the macro level. And Isabelle, this is where I'd like you to come in. Recently, UNFPA, ILO, World Bank did some great programmatic guidance of integrating SRH and economic empowerment for young people. And this included some key macro level interventions. I wonder if you can just expand a bit more on a policy environment that's conducive to supporting these interventions and how we can advocate for more of that. Thanks, Isabelle.
Thank you very much. And thanks for being here. It's really exciting to be on this panel. And maybe let me just first say a few words about the guidance note, the programmatic guidance note itself. And I think the why we need it, I think the scene was set, Misozi talked about it. It is really to see how we can create synergies, how we can improve ASRH outcomes through economic empowerment, but also how can we actually improve economic empowerment outcomes through ASRH. So it really speaks, and the guidance note was developed to really speak to implementers and practitioners from both backgrounds, so an ASRH background or an economic empowerment background. And it has a lot of best practices. The DREAMS initiative is one of them that is listed in it. It has evidence-based programmatic principles that have to be taken into account. It has a flexible theory of change model that looks at the micro, meso, and macro level and gives you concrete example on how things can be done. And it has a monitoring, evaluation, and learning framework with specific indicators that you can pick and choose from and see how they would speak to your program. So it has a lot of links and resources that are in there. So it's meant for practitioners and to see what works for whatever youth program you're already implementing and how to make it more holistic and more comprehensive to really meet the needs of the young people. And so on macro level interventions, I think a very first important step is really to know your environment. So do a political economy analysis, which I think we normally in our ASRH programs don't do, right? So really have this foundational information on what is the current political, economic, and market climate. And how can we introduce new activities, how can we expand economic empowerment activities. And this really also helps us to understand what are the concrete barriers that exist. They can be administrative, they can be institutional, they can be systemic on what is stopping young people to be economically empowered, to be part of the workforce. And that helps us to identify entry points, to really be politically smart, to where can we really get in and create those pathways of reform. And so advocating with young people, together with young people for those changes is very important. And I think as for all policy level interventions, one of the important things is really to talk about budget allocations as well. And there are some tools that are already out there that are very useful. There is the UN Women's gender responsive budgeting manual, which I think is a very good guidance to see how can we really make sure that the budgets allocated are gender responsive. There is also UNICEF's child and adolescent friendly budgeting efforts that are very useful. So really to see how can we make those government budgets speak to the needs of young people on an ASRH and economic empowerment level. And then I think something that we really have to start thinking more about and getting out of our little comfort box of ASRH or HIV interventions where we know everybody and where we're cozy, right? We're a family, but how do we find new partners that go beyond our usual reach? How do we how do we find an ILO or World Bank to work with us? How do we learn from each other? And how do we create this new creative partnerships? Because as ASRH organizations or HIV organizations, we are not the experts in economic empowerment, but there are many experts out there. So really start this discussion, start this dialogue on how we can work together to together improve both the economic empowerment outcomes and the ASRH outcomes of young people.
Brilliant stuff. Thank you so much. The importance of us all working across sectors, addressing many of those structural drivers. Yeah, thank you so much, Isabelle. Okay, we only have a very few minutes left for questions from the audience. So, also because some of our time was taken up by doing the introduction, can we have a few more minutes? I think that might be a no. Anyway, I also got a message just to make sure that the abstract presenters for the next session, if you could make sure that your PowerPoint presentations have been delivered up the back, that would be fantastic. Yes, I got another minute, great. Okay, where is number 1? No, we'll go with number 2 then. Yep.
Can I go? Okay, thank you for the presenters and the panel. I am Suleiman from Burkina Faso, and I have one question for Ms. Misozi, which is, I would like to know how was the retention rate of the youth involved in the program? And the second question is for Mr. Xavier, and I would like to know, with regard to your presentation, what is the those youth that are not in school are accounted for? Thank you.
Sure. Number 3.
Hi. Hi, I'm Aoife Doyle from LSHTM and BRTI Zimbabwe. I have a question about CSE in schools. And I was interesting points that you made, and I was wondering if you think enough has been done to engage the parents and community, because I think CSE seems to be in some settings there's curriculum there and the implementation guidance, but the actual implementation is not happening, and perhaps that's also a resource issue to do with prioritization in schools over certain sessions given limited resources. So I was wondering if additional resources are needed to really get CSE implemented, or perhaps that's not a realistic option in some settings, and so CSE needs to be outside schools. So any thoughts on that?
Thank you. Maybe we can just take one more question and then the panel can respond to that. Because of the interest of time, I think I saw a hand just now here. Ma'am, you can go. For those who have questions, you can reach out to the speaker today. They are not running away from today's session, so you can reach out to them and ask your question. Thank you.
Thank you so much, and thank you to the panelists and Xavier for the comprehensive information. I just want to highlight that as much as we are talking about LSE in schools is very good. Oh, apologies, I'm Zandile from Eswatini. Okay. LSE in schools, yes, is very good and it yields good results. But we are having challenges, especially in East and Southern Africa, in the countries where LSE is not exempted. Now, because it's not exempted, it is not given much focus. So how are we going to achieve the indicators under LSE? For us, we have developed even the EUP policy, the Early Unintended Pregnancy Policy. We want to take the learners back to school. Yes, it's a good thing. And also we have developed the guidelines for linking learners with healthcare facilities, and we are currently improving the youth friendliness. But if the LSE is not exempted, we are not going to make it. I have a feeling that we need to support the countries where the LSE is not exempted to make sure that it is exempted so that it is given much weight and much focus, because we can see that it yields good results even in terms of school-related gender-based violence. Thank you.
Thank you so much for your comment. Panel speaker, maybe you would like to respond to the question that raised.
Thank you.
Very quickly.
Okay, so very quickly on retention rates, I think the project wasn't specified, but I can speak to both of them. So there are no challenges there, and I think the advantage with the design of the project is that these adolescents are coming for various services. And we can agree that they're constant needs. So when they're enrolled into the safe spaces and they're providing HIV prevention education and livelihood skills, they're also accessing educational support. So at any given time, they're still coming back for different interventions. But it's interesting to note, because I had the privilege of working on the AYP project as well many years ago, that there are higher dropout rates than the DREAMS project when it comes to the enrollment into the program. So I think that's a whole different study altogether, but it could be because AYP was targeting both rural and peri-urban, and DREAMS is purely urban. So I do recall that retention amongst the rural population, it could have been maybe distances to the service delivery point or other reasons, but general picture is that I think the fact that they're coming constantly and they have so many different services that they can access, we haven't really had challenges regarding retention. Thanks.
Well, I think there are many reasons why CEC is not implemented, but one of them is that it is not always in education sector plans, and that it is not institutionalized. It is delivered through projects with a limited lifetime. Also, basic courses are not implemented because of strikes, because of many other reasons, and CSC is often axed as a result of this situation. And what has been done to improve implementation? Well, there are many tools out there, and I would really encourage the audience to Google CSC platform and O3 program, CSC platform, and it leads you to a platform with many resources on parent-child communication, on lesson plans, and many other things that you can use to improve implementation. Suleiman, I'm sorry, I didn't quite get your question.
Accounted for in the different programs.
What tools are available to youth out of school? Well, I've mentioned two smartphone application. One of them is TuneMe. It's been developed by with UNFPA support. And you can go and download it. It has lots of content and it helps make links to services. And another one for the French-speaking among us. I don't know how many there are, but it's called Hello Ado, and you can also download it on Play Store. And it has lots of content, videos, and also lists of services depending on where you are. For some countries, you can start with that, and there are reliable tools.
Thank you so much to the amazing speaker and also the session. Please give a big round of applause to them. And with that, I'll pass it back to Alice to officially close the session. It's done? Okay, it's done.